If I say what I'm about to say publicly, some people in medicine will not be happy with me. Because there are medical tests performed every day on people over 60 that lead to more scans, more specialist visits, more procedures, and, inevitably, more money flowing through the healthcare system. But here's the part that should concern you most. Some of those patients were never sick to begin with. They walked into a clinic feeling healthy. They had no alarming symptoms. They agreed to one extra test because someone said 5 words that are almost impossible to argue with. Let's do it just in case. Sometimes just a tiny abnormality that had been quietly sitting inside their body for years without causing a single problem. But once it was discovered, everything changed. Another scan was ordered. Then another appointment. Then a specialist became involved. Maybe there was a biopsy. Maybe a procedure. And within weeks, a person who had entered the doctor's office feeling perfectly well was suddenly living from one medical result to the next. I've practiced medicine for more than 20 years. I believe in screening when it has a clear purpose. I've seen early detection save lives, and I would never tell you to ignore symptoms or reject necessary medical care. We've been taught to believe that earlier detection must always be better. Find everything, catch everything. Don't give disease a chance to hide. But what if the thing we discover was never going to hurt you? What if you could have lived another 10 or 20 years without ever knowing it was there, and without it ever changing your life? And what if discovering it leads to something that does? That's the conversation I want to have with you today. I'm going to show you 4 medical checkups that I believe deserve much more careful consideration as we get older. Not because these tests are always dangerous or should always be refused, but because when they're used without a clear reason, the consequences can extend far beyond the original test. I've seen it begin with a completely healthy person and end months later with that same person weaker, more anxious, and wondering how everything went so far. And the 4th one may surprise you most, because it's a test many older adults have been taught for years they should never skip. But first, you need to understand what can happen after a doctor finds that first tiny abnormality. There's a name for the chain reaction that can follow. Doctors sometimes call this the cascade effect. And the reason I want you to understand it before we discuss any specific test is simple. The greatest risk may not come from the first test. It may come from everything that happens afterward. Consider a woman I'll call Margaret. She's 71, lives independently, volunteers at her local library twice a week, and feels well. During a routine appointment, she agrees to an additional test, even though she has no symptoms. The test finds a small abnormality. Her doctor isn't particularly alarmed, but he can't say with complete certainty that it's harmless. So he recommends as another test to get a clearer answer. That second test still doesn't provide certainty. Now Margaret is referred to a specialist. The specialist looks at the results and faces the same problem. It probably isn't dangerous, but probably is not the same as definitely. A biopsy is suggested. Do you see what's happening? At every individual step, the next decision sounds reasonable. Nobody is trying to hurt Margaret. Her doctors are being cautious, and Margaret naturally wants reassurance. But each reasonable decision creates the next one. The biopsy may require sedation or a needle entering tissue. That introduces possibilities that didn't exist when Margaret felt perfectly healthy. Bleeding, infection, reactions to medication, or other complications. If the biopsy is unclear, another procedure may follow. And if something suspicious is found, surgery may suddenly enter the conversation. Meanwhile, something else has already changed. Margaret's life. Instead of planning lunch with friends, she's planning appointments. Instead of sleeping peacefully, she's waiting for results. Her family starts worrying. She begins interpreting every small ache as evidence that something is wrong. And remember where all of this started, with an abnormality that may never have caused her any harm. That's what makes the cascade effect so important after 60. As our bodies age, tests can reveal changes that may look unusual without necessarily representing a dangerous disease. The challenge is that once an abnormality appears on a report, neither the patient nor the doctor can simply forget that it exists. The question is no longer only, could this be something? It becomes, how far should we go to prove that it isn't? Sometimes further investigation is absolutely necessary and life-saving. But sometimes the pursuit of certainty brings its own costs. Weeks or months of anxiety, repeated appointments, invasive procedures, bleeding or infection, complications, and time taken away from the life we were trying to protect in the first place. Keep this chain reaction in mind as we move through the next 4 checkups, because you'll see the same pattern appear again and again. And the first example is perhaps the easiest place for this cascade to begin, because one modern test can look almost everywhere inside your body at once. Test 1. Whole body MRI/CT scan. I understand why these scans are appealing. The promise sounds almost irresistible. Look through the entire body, find hidden problems early, and deal with them before they become dangerous. For someone who wants to stay healthy and independent for as long as possible, that can feel like the ultimate form of prevention. But there's a problem. The more places you look, the more likely you are to find something. Imagine a 66-year-old man named Thomas. He's retired, plays golf on weekends, walks several miles without difficulty, and recently had a normal physical examination. He has no unexplained weight loss, persistent pain, breathing problems, or other concerning symptoms. Thomas decides to have a whole body scan for reassurance. Instead, the report gives him 3 new things to worry about. There's a tiny nodule in one lung. A small cyst is noted on one kidney. And the radiologist mentions an area on the liver that cannot be completely characterized from this scan. The lung finding may require another scan several months later to see whether it changes. The liver finding might lead to more detailed imaging. The kidney cyst may need to be reviewed by another doctor. Suddenly, the scan Thomas chose to reduce uncertainty has created 3 separate uncertainties. This is where you'll often hear the term incidental finding. It simply means something discovered unexpectedly while looking for something else. A body that has been working for 6 or 7 decades will often contain small structural changes that show up on modern imaging. Some matter, many do not. The difficult part is determining which is which. Think about an old house that has been standing for 60 years. If an inspector examines every pipe, wall, floorboard, and beam with extremely sensitive equipment, they're almost certain to find imperfections. A mark doesn't automatically mean the house is about to collapse. The human body is far more complicated. But the principle helps explain the problem. Detecting an imperfection and detecting a dangerous disease are not the same thing. Now return to Thomas. Suppose one finding looks slightly different on the follow-up scan. His doctor refers him to a specialist. The specialist recommends a biopsy because imaging alone cannot provide complete certainty. Thomas now faces a procedure, and procedures introduce risks such as bleeding, infection, reactions to medications, and other complications depending on where and how the biopsy is performed. Notice the cascade again. Thomas didn't begin this journey because he felt sick. He began because he wanted proof that he was healthy. For an older adult without concerning symptoms, I want to know much more than what appears on an image. Can you climb a flight or 2 of stairs comfortably? Can you rise from a chair without struggling? Are you becoming less steady on your feet? Are you sleeping well? Are you staying physically active? I also want to know what you're eating, whether you've lost weight or strength unexpectedly, which medications and supplements you're taking, and whether you have regular contact with friends, family, or your community. Those questions may sound less impressive than a machine scanning your entire body, but they tell us something extremely valuable: how well your body is actually supporting your life. Of course, imaging can be enormously useful when there is a clear medical reason for it. New symptoms, an abnormal examination, a known medical condition, or a specific risk may completely change the decision. It's to understand that more information is not automatically better information. Before agreeing to a scan simply to check everything, ask what doctors would actually do with an unexpected finding, and whether discovering it is likely to improve your health. Because as we grow older, one of the most important questions in medicine isn't simply, what can we find? It's, will finding it help me? Test 2. Brain MRI for mild forgetfulness. This one is especially emotional, because few things frighten older adults more than the possibility of losing their memory. Imagine Susan, 73, who still manages her own finances, drives to the grocery store, cooks for herself, and meets friends every Thursday. Lately, however, she's noticed a few frustrating moments. She couldn't remember the name of an actor during a movie. She walked upstairs to get something, and briefly forgot what she wanted. Her daughter notices Susan complaining about these moments and immediately worries about Alzheimer's disease. Mom, maybe you should get your brain scanned. That suggestion comes from love. And Susan wants reassurance too, so she asks for an MRI. Then the report arrives. It contains phrases such as mild cerebral atrophy, white matter changes, small vessel disease, or age-related changes. Susan doesn't hear the words age-related. She hears atrophy, she hears lesions, she hears disease. Yesterday, she thought she was a healthy 73-year-old who occasionally forgot a name. Today, she's wondering whether every misplaced pair of glasses is evidence that she's losing her mind. This is where an image can sometimes create more fear than clarity. A brain changes as it ages, just as other organs do. Certain findings on MRI become more common later in life, and their presence alone doesn't tell us how well someone is thinking, remembering, reasoning, or functioning from day to day. That's the distinction I want you to remember. A picture of the brain and the performance of the brain are not the same thing. So if Susan came to me worried about mild forgetfulness, I wouldn't begin by asking, what does her brain look like? I'd begin by asking, what can Susan still do? Can she manage her bills correctly? Does she remember appointments? Can she follow a recipe she's familiar with? Is she getting lost in places she has known for years? Has her personality changed? Is her memory getting noticeably worse over time? We can also use brief cognitive assessments in the clinic to examine memory, attention, language, and other thinking skills. These simple evaluations often tell us far more about whether there is a meaningful problem than immediately jumping to an MRI. And then there's another important step. Look for things that can affect memory without being dementia. Some medications can cause confusion or mental fog. Vitamin B12 deficiency can affect thinking. Depression can make concentration and memory noticeably worse. Poorly controlled thyroid problems may contribute. Sleep apnea can leave someone exhausted and mentally sluggish during the day. If one of those issues is contributing to Susan's symptoms, identifying and addressing it may be far more useful than frightening her with an MRI report she doesn't fully understand. Now, there is an important line here. If memory problems are clearly progressing, if someone begins getting lost in familiar places, repeatedly misses important payments, struggles with tasks they previously handled easily, or develops other significant neurological changes, then a more complete medical evaluation is appropriate, and brain imaging may be part of that evaluation. The message is, don't let normal moments of forgetfulness automatically convince you that you need a picture of your brain. Test 3. Motinacock Stress Test. Let me introduce you to Richard, 72. He is scheduled for a relatively routine operation. He still walks around his neighborhood most mornings, climbs the stairs in his home, carries groceries from the car, and occasionally spends an afternoon working in his yard. He has no chest pressure when he walks, no unusual shortness of breath, no unexplained dizziness. His daily activities haven't suddenly become more difficult. But because of his age and the upcoming procedure, a cardiac stress test enters the conversation. Richard thinks, why not? It's better to be safe. So he gets on the treadmill. Then something on the test looks abnormal. And now the cascade begins again. An abnormal stress test does not automatically mean someone has a dangerous blockage. Depending on the person and the type of test, false positive results can occur. But once an abnormal result exists, doctors may understandably feel the need to investigate it. Richard is referred to a cardiologist. More testing follows. Eventually, cardiac catheterization is discussed. a procedure in which doctors examine the arteries supplying the heart more directly. Suppose that investigation finds some plaque and narrowing. That may sound frightening, but finding plaque does not automatically mean Richard was on the verge of a heart attack, or that an invasive treatment is necessary. What happens next depends on his symptoms, the severity and location of disease, his overall health, and many other factors. Yet something may have already changed before any treatment begins. Richard's confidence. Before the test, he walked without thinking about his heart. Now every time his pulse rises, he notices it. The hill he used to climb without hesitation suddenly feels threatening. He stops doing yard work because he's afraid of pushing his heart too hard. A test intended to make him safer may unintentionally make him less active. And for an older adult, losing confidence in movement can have consequences of its own. If you can walk at a reasonable pace, climb stairs, carry out your usual activities, and do these things without chest discomfort, unusual breathlessness, dizziness, or a meaningful decline in what you're able to do, that information matters. Your everyday life is continually showing your doctor something about how your cardiovascular system performs under ordinary demands. On the other hand, if walking that used to feel easy suddenly leaves you breathless, if exertion causes chest pressure, if you become dizzy, or if your ability to be active noticeably declines, those changes deserve medical attention. The difference is important. Testing should answer a meaningful clinical question, not simply respond to the number on your birthday. For some people who have no symptoms but need a better estimate of their future cardiovascular risk, doctors may also discuss tools such as a coronary artery calcium score. It can provide information about calcified plaque in the coronary arteries and may help guide preventive decisions in appropriately selected patients. But it isn't a universal replacement for a stress test, and it isn't something everyone over 60 automatically needs either. The right choice depends on your individual risk, symptoms, medical history, and what decision the result would actually change. So before a routine stress test, ask a simple question. What are we trying to learn from this test, and what would we do differently based on the result? Test 4. Routine colonoscopy after 75. Before anyone misunderstands me, let me make something very clear. I am not against colonoscopies. When used at the right time and for the right person, colonoscopy is an important tool for colorectal cancer screening. It allows doctors not only to look for cancer, but also to find and remove certain polyps before they have the opportunity to become dangerous. But a test that makes sense at 55 does not automatically offer the same balance of benefits and risks at 78. Consider Helen, 79. She has followed her screening schedule for years. Her previous colonoscopies were reassuring. She has no known history of concerning polyps, and she doesn't have a strong family history or another condition that puts her into a higher risk category. She also has no digestive warning signs. Then she receives another reminder that she's due for screening. Helen's first thought is understandable. I've always done this. Why would I stop now? The potential benefit of screening is something that often develops over years. The risks of the procedure, however, happen now. And with colonoscopy, the procedure itself isn't the only consideration. Preparation usually requires emptying the bowel, which means significant fluid loss. A younger adult may tolerate that reasonably well, but an older person may be more vulnerable to dehydration, weakness, dizziness, or problems related to certain medications and medical conditions. Then there is sedation. Many older adults tolerate it well, but age and overall health can influence the risk of confusion, breathing difficulties, blood pressure changes, and other complications. And although uncommon, colonoscopy can cause bleeding or perforation, a tear in the wall of the colon. A serious complication may require hospitalization and, in some cases, urgent surgery. For a frail older adult, recovering from a major complication can mean more than spending a few days in the hospital. It can mean losing strength, needing rehabilitation, and sometimes struggling to return to the level of independence they had before. So after 75, the question shouldn't simply be, am I due? A better question is, given my health, my previous screening results, my personal risk, and what this test could realistically accomplish for me, does screening still make sense? For some people, the answer may absolutely be yes. A healthy 76-year-old with a longer life expectancy and particular risk factors may have a very different conversation from an 84-year-old with several serious medical conditions and repeatedly normal previous screening. And screening is very different from investigating symptoms. If you develop blood in your stool, a persistent and unexplained change in bowel habits, ongoing abdominal pain, unexplained weight loss, or iron deficiency anemia, don't dismiss those changes simply because you're over 75. Those symptoms deserve medical evaluation, and colonoscopy may be entirely appropriate. That's an important distinction. Deciding whether to continue routine screening is not the same as ignoring warning signs. There are also other colorectal screening approaches that may be appropriate for some people. So this is a decision worth discussing with your clinician, rather than simply continuing or stopping out of habit. And don't overlook what you can do every day. A diet that regularly includes fiber-rich foods, such as vegetables, fruits, beans, lentils, and whole grains supports digestive health while benefiting other parts of the body as well. Staying physically active and maintaining other healthy habits remain important too. So, if you're approaching or past 75, don't automatically say yes to another colonoscopy. But don't automatically say no either. Ask whether the expected benefit still outweighs the burden and risks for you. That is really the lesson behind all 4 tests we've discussed today. Good medical care isn't about doing the maximum number of tests possible. And it isn't about avoiding medicine. It's about choosing care that has a meaningful chance of making your life better. Because when we put these 4 tests side by side, they reveal something much bigger about the way we should think about health after 60. When you look back at these 4 tests, I hope you notice that they all point to the same lesson. The real issue isn't that MRI scans, heart tests, or colonoscopies are bad. They aren't. Every one of these tools can be valuable, and sometimes life-saving, when there is a clear medical reason to use it. The problem begins when we start believing that more testing must always mean better healthcare. As we saw with the cascade effect, one test can uncover an uncertain finding. That finding can lead to another scan, another specialist, another procedure, and sometimes another complication. Before long, the original question, "Will this actually help me?" can get lost somewhere along the way. At this stage of life, health isn't about collecting perfect numbers on a laboratory report or trying to make every medical image look flawless. It's about protecting what allows you to live the life you value. Can you get out of bed and move through your day with confidence? Can you take a walk, prepare your meals, enjoy a conversation, spend time with the people you care about, and continue doing the things that give your days meaning? So the next time someone recommends a medical test, you don't need to become suspicious of your doctor, and you certainly shouldn't reject necessary care simply because of something you heard in this video. Instead, become an informed participant in the decision. Ask, "Why do I need this test?" Ask, "What are we looking for?" Ask, "What happens if you find something?" Ask, "What are the risks at my age and with my health history?" And perhaps most importantly, ask, "Will the result change what we do?" A good medical decision isn't always about doing more. Sometimes, it's about doing exactly what is necessary. And nothing that doesn't meaningfully improve your care. Your age should never be the only reason to perform a test, and it shouldn't automatically be the reason to avoid one either. Your symptoms, medical history, personal risks, overall health, previous results, and your own priorities all belong in that conversation. If there's one idea I hope you remember from today, let it be this. Don't chase every possible abnormality. Protect the life you're actually living. If this video helped you look at medical testing differently, share it with someone over 60 who might benefit from this conversation. And subscribe if you'd like more practical discussions about staying healthy, independent, and informed as you grow older. I'd also like to hear from you in the comments. Have you ever had one medical test lead to several more tests or procedures you weren't expecting? Your experience may help someone else realize that asking questions isn't refusing healthcare. It's being an active part of it. Thank you for spending this time with me. Take good care of yourself. Keep asking thoughtful questions. And remember, the goal isn't simply to add more years to your life. It's to protect as much life as possible in the years you have.